Hello, and welcome back to the McKnight's Online Forum. We're so happy you could join us today during this unique time. Our final webinar is under the leadership track and is titled COVID-19, an updated infection prevention strategy for incontinent residents. I'm McKnight's editorial director, John O'Connor, and I'll be your moderator. In a moment, you'll be hearing from our presenters. Darren Marani is SVP, U.S. Non-Acute and Inside Sales for Cardinal Health. Debbie Pius is the firm's Senior Clinical Consultant. But before we dive in, there are a couple of housekeeping matters we need to attend to. Today's slides are available for download. Just click on the button on your screen and find a PDF of the slide deck to print out. If you're having audio problems with this broadcast, please first check the volume control on your machine. We have found this is the most common cause of sound-related problems. If you are still having issues, please click on the Test Your Connection button. Also, note there is no call-in number. Sound comes from the computer speakers. We will have some time for a Q&A session near the end of the presentation. If you have any questions for our speakers, please feel free to tap them out and submit them directly to us, starting now. We'd also like to note that this program is made possible by support from Cardinal Health. You can learn more about COVID-19 and the firm at www.cardinalhealth.com. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards, NAB. It has been approved for 1 clock hour. However, you do need to stay tuned to the event for its entirety in order to receive a certificate. Finally, this session will be archived and available on demand shortly after this live broadcast. You can access it again, or others can experience it for the first time by simply going to the registration page to enter the studio. However, please know that CE is available only to those watching the live broadcast. Well, let's meet our presenters today. Darren Marani is Senior Vice President, U.S. Non-Acute and Inside Sales for Cardinal Health, as I just mentioned. And Debbie Pius, RN, BSN, is the firm's Senior Clinical Consultant. Darren is an industry veteran with nearly 2 decades of professional experience in this field. He has been with Cardinal Health for nearly 5 years and has served in his current role since August of 2018. Debbie has been an LPN since 1981 and an RN for 20 years. She is an active member of the Wound, Ostomy, and Continence Nursing Society. In 2016, she joined Cardinal Health and holds the position of Senior Clinical Consultant, focusing on advanced skin and wound care in the long-term care facilities. Darren, we are really thrilled that you and Debbie can join us today. But I have to ask, is there anything good coming out of this pandemic?
Thanks, John. So first, this global crisis has caused many of us to change the way we live and the way we work. And the impact is felt across the entire continuum of care and beyond. And if I could see any good coming out of this pandemic, I would say that as an industry, COVID-19 has shown our ability to adjust, adapt, and act with urgency, and further stresses the importance of medical supplies inventory and crisis management plans. Also, it has caused the landscape to evolve. There have been many accelerating trends in healthcare that COVID-19 has now increased their visibility, their prominence, and acceptance. For example, telemedicine. Customers and providers are acclimating well to this new way of conducting patient visits. Physician offices, hospitals, and other areas of care now use technology to meet with patients with similar effectiveness, achieve high patient satisfaction rates, and offer the convenience and safety that telehealth provides to all. Also, we've seen a rise in digital technology and e-commerce. We've all learned new ways to connect. Almost everyone has been on a virtual meeting for either professional or personal reasons since mid-March. Children and adults are having birthday parties over Zoom and Skype and Microsoft Teams. and the acceptance rate has increased dramatically, and this has the potential to change how we interact with providers. And third, lastly, providers must invest more to create substantial and sustainable measures to help limit cross-contamination. Infection control practices, training, and product selections will be a top concern as they consider changes to patient waiting in recovery rooms, how ORs are turned over, and of course, social distancing measures. And this will include more scrutiny of product selections with patient and staff safety reigning as the utmost concern.
Well, that's a great answer, Darren, and I really appreciate it. Are you ready to get started?
Yeah, absolutely.
I'll take it away.
So first, thank you all for joining us today. On behalf of Debbie and myself, we know how busy you are during this crisis, and your time and consideration is notable. So let me review the goals for today. We want to help increase your knowledge of the following. First, the ever-changing COVID-19 landscape, as we're continuing to learn more and more each day. We also want to create awareness of cross-contamination challenges, specifically in long-term care. We want to promote infection prevention protocol enhancements, and then offer unique solutions for incontinent residents. So let's get started. So let me be the first to officially welcome you to the webinar and again say thank you, and we're thrilled for this opportunity, and we really look forward to the next hour together. So we are facing unprecedented times with COVID-19, and this is and will continue to be a fluid situation as we learn and make decisions to help safeguard our patients, our caregivers, and the general population. COVID-19 has wreaked havoc on our hospitals, our ASCs and physician practices, and of course the rest of the economy. But today, we want to spend time discussing long-term care. Long-term care facilities are a critical component of America's healthcare system. They are unique as they serve both healthcare providers and full-time homes, and have some of the most vulnerable populations due to advanced ages, the prevalence of comorbidities, and close proximity of the residents. Long-term care has posted the highest mortality rates versus other healthcare institutions, and COVID-19 is a tremendous risk to this segment. CMS and CDC, at President Trump's direction, have worked together to issue unprecedented targeted direction to long-term care facilities, including a general prohibition of visitors that was implemented in mid-March, as well as strict infection control and other screening recommendations. However, recent observations made by the CDC and CMS experts that were on-site in facilities, they have emphasized that even more must be done to protect this class of trade. And therefore, it is up to the individual facilities to ensure that they are providing the highest level of prevention to help limit the spread. I want to take a moment and give a sincere thank you to each of the healthcare professionals and frontline workers in long-term care and across the healthcare continuum. You truly are the heroes in this fight, and we want to ensure that your safety is top of mind as well. And as I mentioned, each day that passes gives us more information on what we can do to help flatten the curve and provide more protection for those most at risk. And that's why we're so excited for today's presentation, which focuses on infection control enhancements specifically related to incontinent residents. And with that, I will pass it over to Debbie Pius, clinical consultant for Cardinal Healthcare.
Thank you, Darren. I appreciate that. So, continuation of this educational presentation should be a review of infection control and incontinence management during this disruption within long-term care facilities due to the COVID-19 pandemic. I want to stress review because all of you are at the front line of this pandemic and are already armed with pre-existing infection control protocols. However, does infection control and incontinence management look different now that you are being challenged with this pandemic? So let's start the presentation talking about health care associated infections and types of transmission. The primary source of health-associated infection transmission in long-term care is through human contact due to the daily proximity of residents and staff. The highest susceptible hosts in long-term care are the residents due to age, compromised health, and altered immune systems. Portals of entry are through mucous membranes, skin, the respiratory system, and gastrointestinal tract. The diagram on the right also displays the chain of cross-contamination. The infected individual releases the virus to a reservoir, followed by a point of exit where the virus is transmitted and enters an individual at risk, such as the long-term care resident. Several types of transmission are impossible. Contact transmission is through direct human touch, staff to resident or resident to resident. Indirect contact is the handling of contaminated products. A good example would be lifting devices that are used between residents daily. Indirect contact can also be the droplets expressed through coughing and sneezing from a resident or staff member to another resident or staff member. Individuals within 3 to 6 feet of another individual's cough or sneeze is a primary recipient of those droplets. Airborne transmission is the nuclei that remain suspended in the air and is not detected by the naked eye. In relation to airborne transmission and incontinence, think about the room that houses your hopper to rinse and clean soiled, reusable linens. The diagram on the right also displays how the COVID-19 virus travels with an individual from the community where he or she may have contracted the virus. The infected individual sneezes and nuclei remain in the air or land on surfaces such as tables, phones, or computers. Individuals unaware of the occurrence later pass through the environment, which has been contaminated with air-filled nuclei, or touch a surface that has not been disinfected. These contaminated droplets eventually enter through the nose, mouth, and potentially into the lungs of these unsuspecting individuals, and the transmission of the virus spreads. Now let's consider the colonized staff member or resident that is currently not displaying any symptoms of illness, but has the virus harboring within their individual body. With the next direct or indirect contact by the colonized individual that is compromised with their immune system, which could be a staff member or resident, the virus can spread throughout the facility. Infections in long-term care affect the aging resident because their organs can be compromised and the ability to fight infection is limited. Close resident contact, like we spoke about earlier, impacts the spread of the virus. Infections are expensive to treat due to the potential need to place a resident in a private room, cost for staff PPE, and pharmaceutical expenses, just to mention a few issues. The fear of contracting the infection can create resident fear and room isolation, reducing socialization. Staff fear of contracting an infection and the potential spread of such infection to their families can result in staff calling in sick daily or even staff resignation. Infection prevention is priority. COVID-19 is making infection prevention protocols more imperative every day. The aging resident and infection can be related to a variety of circumstances. Wounds among the aging resident can be surgical due to joint replacement, skin tears, incontinence-associated dermatitis, and/or pressure injuries. The elderly resident can develop poor nutritional habits due to reduction in the sense of smell and taste. Ill-fitting dentures can also reduce chewing capabilities and possible swallowing complications. Chronic diseases such as diabetes, heart disease, renal disease, cancer, etc., can lead to altered resident immune systems and place them at higher risk for infection. Limited or poor hygiene can be related to the resident's poor hand hygiene following bathroom use and or routine refusal of weekly baths or showers. Incontinence can lead to incontinence-associated dermatitis and possible skin breakdown, leading to a primary port of entry for potential infection. So let's review common long-term care infections. Lung and respiratory infections can spread throughout a facility through direct, indirect, or airborne transmission. The resident's fragile skin may result in skin breakdown and can be a primary port of entry for infection. Urinary tract infections in the elderly resident can be a result of reduction in hydration, poor perineal hygiene, and indwelling catheter insertion. The sluggish motility of the GI tract in the elderly resident can also lead to poor nutritional absorption and compromise the immune system. COVID-19 is the new virus on the horizon. However, many people continue to die each year in the U.S. from C. difficile. Are the current GI symptoms and fecal incontinence exhibited by a resident related to C. difficile or COVID-19? Let's review some facts about C. difficile before we discuss how C. difficile impacts the GI system. A well-known discovery is that antibiotics that treat other infections can increase the risk for C. difficile. Antibiotics kill good GI bacteria, while the C. difficile spores resist the acidity of the stomach and inhabit and grow within the GI tract. The levels of gut bacteria become imbalanced, and the bacterium can multiply and cause severe health problems. Why are long-term care residents at risk for C. difficile? C. difficile affects the elderly on long-term antibiotics who have compromised immune systems and reside in a long-term care facility. Cross-contamination can result due to the proximity of residents and staff members who also may be caring for a wide variety of residents within that facility. Symptoms of C. difficile are a result of inflammation of the lining of the large intestine. Symptoms such as watery diarrhea, frequent bowel movements, fever, pain, or tenderness in the stomach, nausea, and reduced appetite may be evident. C. difficile spores are also highly resistant to cleaning and disinfection measures on surfaces outside of the human body. Based on that information regarding C. difficile and further discussion later in this presentation regarding COVID-19, let's review why standard precautions are such a priority. Standard precautions are universal and incorporated in the protocol of every facility. PPE, such as gloves, masks, gowns, and eye protection are the common tools to prevent cross-contamination from both respiratory droplets and feces. Let's also review some additional means of standard precautions. Proper hand washing, covering your mouth and nose with your sleeve or tissue when coughing or sneezing, followed by proper hand hygiene. Keeping the environment clean by properly disinfecting surfaces and medical equipment. Avoiding the recapping of needles and proper disposal of used needles in appropriate sharps containers. Now let's discuss incontinence and laundry precautions. COVID-19 is the new pandemic, challenging all long-term care facilities across the nation. Let's review one of the methods to contain and dispose of this virus. In a recent report from MedPage Today, quote, live virus has been present in the stool of confirmed COVID-19 patients, indicating possible spread through fecal transmission, unquote. Based on that finding, let's talk about ways to mitigate COVID-19 feces transmission. COVID-19 residents may experience GI symptoms such as abdominal discomfort, nausea, vomiting, and diarrhea before the onset of respiratory symptoms. The viral RNA has been detectable in fecal samples from suspected cases, indicating that the virus sheds into the stool. The viral GI infection and potential fecal-oral transmission can last even after viral clearance from the respiratory tract. So how are you managing resident incontinence? Reusable versus disposable underpads? Standard versus premium? Before we explore the options, let's talk about it. Common usage within long-term care facilities has been reusable underpads covered with standard quality underpads typically called chucks. Viruses such as C. difficile and COVID-19 have created an increased demand for disposable premium underpads. So let's review the advantages and disadvantages of all of these products. Generally, soiled laundry travels from the resident's bedside to a hopper for rinsing within the facility, placed in a laundry bag, and left for transport to either an internal or external laundry. 4 basic interconnected factors of the laundering procedures are duration, mechanical action, chemicals, and temperature. If one of these factors is decreased, for example, temperature, then other factors such as chemicals, mechanical action, or time must be increased to achieve the same laundering and disinfecting condition. So are you sure all these laundering requirements are being met for your facility? In addition, remember, soiled linens going to the laundry do not always return as the same clean linens to the same unit or facility. Laundering may certainly have had the dirt removed, but it is far from sterile. Reusable underpads can compromise employee safety due to the handling of the soiled linens. Laundering services can be expensive. There is an increase in nursing time to rinse linens and prepare for transport to laundry. In addition, reusable underpads are contraindicated with the use of low air loss mattresses as they reduce pressure relieving capabilities. Here's a powerful statement. A study in the American Journal of Infection Control discovered that despite the laundering of soiled linens, 93% of clean linens still contain viable organisms even after laundering. So now let's review the benefits of disposable underpads. Limited indirect handling of contaminated products, no cost for laundry services, there is conservation of water related to laundering, nursing time is improved with a contain and dispose capability of single-use products, and some disposable underpads are also indicated for use on low air loss mattresses or specialty beds. There is a defined difference between standard underpads and premium underpads. Standard underpads are generally used as a linen or chair protector and made of an absorbent inner fluff layer with a waterproof backing on the pad. These pads are usually called chucks and do not prevent wetback onto the resident's skin and are inadequate for high amounts of incontinence absorbency. Premium underpads have many benefits when compared with standard underpads, such as microclimate management due to the reduction of moisture, heat, and potential skin breakdown. Natural oil and lubricants are protected as the skin remains drier. Overhydration or re-wetting of the skin is reduced, leading to less skin maceration. In addition, the reduced amount of moisture at the skin surface lowers the risk of incontinence-associated dermatitis that can lead to pressure injuries. Finally, only one pad is required versus layers of chucks and linens. The use of basins and soap and water during resident bathing with reusable washcloths can also be a source of cross-contamination. If soiled bathwater is not changed during the bathing process, the soiled bathwater can introduce bacteria into areas of non-intact skin. Even though basins are generally rinsed with clean water between each use, bacteria can still reside within the container. We also recently reviewed how linens can still contain microorganisms even after linens have been laundered. Disposable wipes are ideal for incontinence management because they can assist with, again, the contain and dispose process of incontinence. Disposable wipes also leave a protective film on the skin to reduce the possibility of incontinence-associated dermatitis while leaving the resident feeling fresh and clean. We are still learning more about COVID-19, but why take the risk? Prior to the discussion of surveys, this may be a good time for a reminder of the FTAG 483.80, which, as you know, focuses on infection control that includes managing fecal incontinence. So let's talk about surveys. In late March, CMS announced that it would suspend standard surveys for nursing homes. However, they are prioritizing inspections regarding immediate jeopardy, infection control, and self-assessments. The current survey involves two categories. The general standard precaution portion includes staff performance of the following appropriately: respiratory hygiene, cough etiquette, environmental cleaning and disinfection of reprocessing of reusable patient medical equipment. The infection control portion of the survey reviews the following: proper hand hygiene, mitigation of cross-contamination through direct, indirect, or airborne transmission with the proper use of PPE, using standard precautions and minimal agitation while handling contaminated soiled linens, holding contaminated linens and or laundry bags away from his or her clothing during transport of soiled linens. A facility should have a developed and implemented infection surveillance plan for suspected and confirmed cases of COVID-19. Education programs should be developed and routinely executed for staff members as related to COVID-19. Adequate staffing ratios should meet the health and safety of all residents. And finally, adherence to facility environmental cleaning protocols should be enforced to mitigate cross-contamination. Now that we have reviewed all the potential routes of cross-contamination, how are you managing incontinence cross-contamination? As a reminder, single-use, disposable incontinent products can be a solution. There is limited indirect handling of contaminated products, no cost for laundry services. There is a conservation of water related to laundering. Nursing time is improved with the contain and dispose capability of single-use products. And some underpads are also indicated for use on low air loss specialty mattresses. So in summary, COVID-19 is the current disruption in long-term care. Reduction in cross-contamination is key. Disposable single-use patient care products should be a primary focus.
Well, that's fantastic stuff, and thank you so much. We do have some time for a few questions if you guys are available, so if that's the case, I'm going to go ahead and jump right in. One of our viewers asks, what is the proper disposal method for the underpads?
They would, if contaminated, it would be the same as putting it in a red bag for disposal. And or if you don't feel there is contamination, then it would be in just a regular disposal type bag.
Very, very good. And I've got another question here. Will any disposable underpads work with low air loss beds, and what factors allow them to be considered for LAL use?
Not all pads are appropriate for low air loss mattresses. Breathability is one of the issues that come into play, and that has to be evident so that that pad is actually appropriate for that particular bed.
Very good, very good. And another question here is, are there wipes that can be flushed?
There are wipes that can be flushed. They are rare, but they are available out on the market, and there are obviously education pieces that have to go along with that, because staff members have to be aware that they are flushable versus non-flushable, so that they don't dispose of things inappropriately.
Yeah, I have a few plumber friends who recommend against even using them because sometimes there are issues as well. So I think operators have to be pretty careful there. Another question here is, we have many patients, residents that void really large volumes. Could a disposable pad be expected to contain as much as the quilted fabric ones?
Absolutely. Actually, when I do some demonstrations, I do show the high absorbency of pads, of the disposable premium underpads versus the reusable. So yes, I've done it several times. I've shown it. I've watched it happen with residents, and it definitely does absorb a lot more, plus keeping a drier surface at the patient's skin.
Mm-hmm. Very, very good. Very good. And then another question here. Our staff often use the heavy cloth underpads for turning and repositioning. Wouldn't the disposable pads still have to go atop a cloth one to turn residents with limited mobility?
Absolutely not. The disposable underpads have the capability to also, at least some of them do, or you'd have to, evaluate through the distributor, but a good majority of them do have the ability to do repositioning of residents, and each particular product generally has a weight claim to each product so that you know how high the lifting capabilities are for that particular product.
Very good. And another question here, do you recommend open air when using a product such as a premium underpad?
I'm going to have Barbara chime in on that one.
Okay.
Barbara, could you just introduce yourself and add a little bit of information to that?
Absolutely. Hi, I'm Barbara Abunader. I'm the Director of Clinical Operations for Cardinal Health. And through my experience, open air certainly has a lot of benefits, but I think it just needs to, every resident needs to be assessed whether or not that they are a candidate for that. While it certainly promotes a positive microclimate, open air isn't always the best option for specifically male residents. It's hard to contain sometimes, with urination and such. So I would say every resident needs to be evaluated. Certainly you don't want to layer any type of incontinent products. So an underpad often does do what it needs to do with the absorbency, and especially some of the premium containing large voids or large fecal incontinence. But I guess at this point just evaluate each resident individually whether or not an open air policy would be the best.
So kind of a case by case basis then.
Absolutely.
Great. Thank you very much. Another good question here. One of our viewers wants to know, do you have experience with sugar bags? I've used these before for elders with C-diff.
I am not. Barbara, have you?
No, I have not. I'm assuming it maybe is to manage and contain and also help with the odor. But sorry, Michelle, I have not had experience with that. Sorry.
Very good. And then another good question here. One of the viewers wants to know, I'm curious if you have any statistics or are aware of any statistics on what percentage of long-term care facilities are using disposable versus standard underpads.
Kyle, I think I'm going to direct that to you. Kyle, could you please introduce yourself and see if you can answer that question for the viewer?
Yeah, hi everyone. My name is Kyle Madsen. I am Cardinal Health resident, incontinence expert, and spend a lot of time just in this market and the hospital market as well. I'm not aware of specific statistics, the one that's being asked about, but I would say that we do still see a lot of long-term care facilities out there using reusable underpads, which is part of why we want to bring this education to the forefront. And then in addition to that, I'd just add that when we go into the hospital space, we've actually seen premium disposable underpads become more the standard of care for a lot of the reasons that Debbie's outlined today.
Yeah, that seems to make good sense. Thank you. And another viewer has a question about whether you have any soap recommendations for COVID patients, or is one soap pretty much the same as another?
That's a good question. I personally have not heard of any specific soaps. Barbara, have you?
I have not personally. Cardinal Health does have a really robust microsite focusing on the COVID, health pandemic. So I would say, perhaps they're mentioning that, but I will, I'm thinking maybe CDC would have a recommendation. If you are interested in looking at the microsite, please go to www.cardinalhealth.com, and you'll see the Cardinal Health Global Preparedness and Response Plan immediately when you access the page. But I would definitely think the CDC, if they are recommending any special soaps, they would probably be the best one to answer that.
Very good, very good. And here's another question. A viewer asks, are using electronic toilet seats with a remote control for social distancing an option for toileting residents?
I have not heard of that. Barbara, have you?
No, I have not. But interesting concept.
Yeah. I worked in long-term care for 20 years, so yeah, that would be very interesting.
I've visited a number of facilities. I don't think I've seen that yet, although you never know.
Who
right?
knows?
Who knows? There's a lot of varieties of ice cream out there, I guess. Another viewer asks, is the super absorbent polymer hypoallergenic?
Kyle, can you address that one?
Yeah, I can answer that question. In short, it is. We do a ton of biocompatibility testing on all of our products, as do all the other manufacturers on the market, and that is one of the things that these products need to pass.
Very, very good. Another good question here. Does the temperature and standard cleaning of residents' tableware kill the COVID-19 virus?
I think, again, that might be something to go back to the microsite about, unless anybody else, Barbara or Kyle, do you have any insight on that?
No, I personally do not, regarding tableware. So I'm sure that there's specific websites that are talking about that and addressing that, but I unfortunately cannot provide any guidance on that.
Very good. And here's another interesting question. How do you deal with potential sewage backup issues when disposable wipes are flushed down the toilet?
Well, I guess part of it is, first of all, it's about education. Before you even start using those types of products, you need to do the education. And the whole entire facility has to be aware of how the products work, and also, there's limitations with anything. And so they have to be brought to the forefront, and the staff has to be aware, and, just education. Kyle, any other comments?
No, I think that was perfect, Debbie. I think definitely there's room for manufacturers here to help. So if that's something you're dealing with, reach out to your manufacturing partners.
Very good. And here's an interesting question. For memory care residents who may be incontinent, should a schedule be set up for changing the resident while they're sleeping or rather than layering?
Good question. Again, because of the high absorbency of the premium underpad, I find that doing those changes less frequently, even though you still want to, however often you are checking, if it's 2, 4, whatever hours you're checking, you want to abide by your protocols within your facilities. But remember, the higher absorbency of your premium underpads can also keep a drier surface at the skin level, so hopefully preventing additional skin breakdown.
Very good. Very good. And here's a good question. What do you think about using Quick Wick for incontinency?
Barbara, do you want to address that one?
I'm not sure what they mean by Quick Wick. Is this a term I'm not familiar with? So Deb, unfortunately, I can't answer this. I'm not sure. Kyle, have you heard of this? Or maybe Deb, I'm not.
No.
I'm sorry, I'm just not aware of what
yeah.
Quick Wick is.
Okay.
Yeah, I'm in the same spot. I think they might be referencing a specific feature of an underpad or perhaps even a device. So we'll take that one offline and follow up separately with that person. Thank you for the question, though.
Sure, very, very good. And another viewer wants to know, what barriers do you recommend for skin breakdown?
I guess the barriers are also, determined by how severe the skin breakdown is. There's several different products out on the market, and so you have to really be, you're at the bedside, you have to do the assessment, and then based on the assessment, determine what's going to work best for that patient. Barbara, anything else?
Yeah, I mean, certainly all sorts of barrier creams out there and barrier treatments. Again, it's all about assessment and understanding what's the cause and the underlying issue and whether or not any type of barrier is the solution. So, there's so many different products out there. Of course, your premium type underpads are going to help with that, just because of the super absorbent polymer and the microclimate the positive microclimate that they produce. But I would say, it's just all about assessment.
Very, very good, very good. And another lengthy question here. This pandemic does not seem to discriminate. It is affecting people of all ages, sexes, and walks of life. Yet residents in seniors' housing and care communities and their caregivers seem to have been especially hard hit by the COVID-19 pandemic. Why do you think that is?
I think the biggest reason is the close proximity. I mean, you look at long-term care and you look at even assisted living, it's their home. We as individuals that are able to stay in our houses are pretty much quarantined or isolated from the COVID pandemic out there. People that live in facilities, be it again assisted living or long-term care, they have people that are coming from the outside community and into the homes to take care of them. So, there's always that higher risk. There's that close proximity of resident to staff member and the higher risk for cross-contamination. Barbara, anything else?
No, I think, Deb, that was a really great summary. And I think, again, there's just so many touch points with so many people caring for those individual residents. And we can't control, those people go home at night and you can't control what they're doing or how they're doing it or which facility is using, PPE equipment. There's just so many variables. And I think, when you have that along with, you throw in the dementia patient or the resident that's walking around the hallways, touching everything and everyone, it just makes it for so much harder area to manage.
Absolutely. Great points. Here's a probably an obvious question, but probably an important one. Can you talk about why infection control is taking on even greater importance during this pandemic?
I think just because of the unknown. Like in the one slide that I said, COVID-19 is out there, and every day we're getting different news reports. I think there's still a lot of uncertainty about COVID-19. I mean, back when C-diff first came on board, we struggled with that, but somehow we got that better managed. And I think with this new virus that's out there on the horizon, we just need to be as careful as we can and continue to investigate and try to find ways to mitigate it as best possible.
Very good. And we have a clarification on Quick. One of the readers responds, Quick for incontinency is used in hospitals instead of a catheter, and it is hooked up to suction and wicks urine away from the body. Sorry for the confusion. Our facility looked into it but did not purchase it. So I guess that answers the question about Quick.
Yeah.
So,
and actually, hey,
please
John,
go ahead.
in addition to that, I remember seeing that, now that was brought forward. And I think the other question with Quick was also because it is basically a suction type of device, you have potential for pressure injury through the area as well.
Sure.
That was just a thought, a thought.
Very, very good. Thank you. And early in the presentation, protocol review was mentioned, and who should be taking the lead on that?
It depends. It depends on your facility who's actually, is it the risk management individual? Is it, do you have an infection control person? Maybe it's somebody at a corporate level. Maybe it's somebody right within the facility. It all depends on who's been assigned to that. Maybe there's a team of individuals that are looking at infection management. So it varies from facility to facility and corporation to corporation.
Mm-hmm. Very good. And is it your sense that disposables are gaining traction as an option in long-term care?
I believe so. I mean, like I said, I worked in long-term care for 20 years, and years ago, all we knew was the standard underpad, and which was what we called chucks. And now, with all the new advances and the ability to keep skin drier, with state surveyors looking at skin breakdown prior to their focus now on infection control management, we were, always being brought to the forefront to talk about, skin breakdown, pressure injuries, all those things. And these disposable pads can actually help prevent a lot of that and hopefully keep those big tags, those F tags, away from your front door.
Sure. And is it your sense that the surveyors are showing a growing acceptance for disposables?
I think so. I think with anything, as long as the product is being used properly and all the guidelines are being followed, I believe that they are. And I think they're also more accepting of it, too, because they see the benefits of it. So, sometimes it's not only educating staff within a facility. Some state surveyors just don't know about products either, and they need education as well.
Sure, absolutely. And I know you've been doing this for a long time. What do you see is sort of the most easily preventable reason for the spread of infection? In other words, what's I don't want to say a dumb thing, but what's something that facilities do that wouldn't be that hard to fix that could really help reduce their infection rates?
Well, first of all, it would be hand hygiene, and then I guess the second, think about that travel of that laundry. If you're using external or internal laundry services, you're carrying, how many times, I can't even count how many times I would gather up linens, throw them into a linen bag, drag them down the halls, wash them in the hopper, put them in a new bag, and then get them ready for whatever laundry service was out there. I mean, it's that constant touching of everything that really needs to get reduced so that we can help prevent some of this constant cross-contamination.
Absolutely. And this is sort of our classic send-off question. If there's one piece of advice you have for our audience members today, what is it?
I would say really, really look at the single-use products. I know how time-consuming everything is. I know how expensive, multi-layers of products can be versus one product. I know how everybody wants to have great surveys, and so Disposable single-use products can help with all those things, can provide better quality of care for your residents, as well as help manage cross-contamination for your employees.
Very good. And Debbie, before we sign off, any parting thoughts?
I just want to thank everybody that attended today. I know everyone is very busy with COVID-19 in their facilities, so I appreciate the time you allocated to join this presentation. Your attendance truly shows dedication towards the health and safety of your residents and staff.
Very good. Well, that's going to have to be the final word, and very well said. Well, folks, we certainly hope you've enjoyed this webinar. Just so you know, this webinar will be available on demand shortly. We'd like to give our special thanks to our presenters for some really great insight and actionable advice. We'd also like to thank our session sponsor, Cardinal Healthcare. And as was mentioned before, you can find more information about them and about COVID-19 on their website, which is www.cardinalhealthcare.com. Very nice resource. And finally, we want to thank you, our audience. You've been a big part of the success today and have brought up some excellent questions. Once again, everyone, thank you for tuning into this McKnight's online forum presentation. This is John O'Connor from McKnight's, wishing you health, happiness, and better times ahead. Good day.